Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
We know that immunocompromised people play a role in new variants, and this is because, unfortunately, the immunocompromised body is like a good breeding ground for these variants. But we also don't know the extent to which that occurs. Will the virus keep evolving? Will there be new variants? And how do immunocompromised people play a role in this?
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Steven Newmark, Director of Policy at the Global Healthy Living Foundation.
And I'm Zoe Rothblatt, Associate Director of Community Outreach at GHLF.
Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life. But before we get started, we want to be sure that everyone takes a listen to all of GHLF's brilliant podcasts. We have so many to choose from.
We sure do, and as a reminder, you can check all of our podcasts out at ghlf.org/listen. Check out our latest podcast, Beacons for Better Health. On this podcast, you'll hear from this year's recipients of the first annual GHLF Beacons for Better Health Awards, and they'll talk all about how they're impacting patients' lives worldwide.
Yes, I'm very excited for this show. It's going to be incredible to hear from these folks who really give an extraordinary amount for themselves and for patients.
100%. I'm so excited too. Let's start with a listener comment. Are you ready, Steven?
I am ready.
This one came from Jane L., who wrote, "Love listening to this podcast on my way to work."
Thank you, Jane. I love listening to podcasts on my way to work as well, and I'm glad that you've chosen ours on your commute.
Yeah, thank you so much, Jane.
Well, today we're going to talk about what we still don't know about COVID. We've talked a bunch about what safety measures are being dropped, vaccine updates, and what is happening now, but there's still a lot we have yet to learn.
And first, we do have a few news updates. The first thing I want to share with our listeners is that I got my COVID booster shot. That's the new bivalent shot that helps protect against Omicron.
Excellent. Great work, Zoe. I'm going to call you Ms. Bivalent from now on.
I'll take it.
How did it feel?
Now I'm feeling like really relieved it's done with, and I'm going into this season with protection. I talked to my doctor about what's best with timing. I was a bit nervous for the shot, and we decided to do it within a few days of my flu shot, so I only skipped my meds once. I'll say the side effects were pretty mild for me, just tired and headachy, overall okay. There was two things that stood out to me when I went to get my shot. All my other shots have been in the New York, New Jersey area. This was my first one in Tennessee, and it did feel a little different. The pharmacist was not wearing a mask, which made me a little nervous as I'm going in to get protection. I also did feel like it was a little risky of a situation, and I've heard from people in our community that they feel the same, so that was just something that was a bit different for me.
Yeah, we've spoken about this before about the masks coming off, and one of the places, if nothing else, you would like to see masks continue are healthcare settings, and I consider pharmacies to certainly be healthcare settings, but the fact that the actual pharmacist who was administering the shot was not wearing a mask, that's concerning. I'm beaten down.
Well, I was in my mask, so I at least felt like I have some level of protection. And then the other thing, this was just more logistical, is that because I'm immunocompromised, I've got a bunch of shots. I had the 3 for the primary series, then the booster, which is technically the 4th shot, and now this COVID Omicron booster was the 5th shot. There's no room on my COVID card. She was like squeezing it in at the bottom, and I'm just wondering what people in our community are supposed to do. Like, do we get new cards? There's not really any more room.
Yeah, I think what you're supposed to do is you're supposed to get a second card, is how it's technically supposed to work. I guess a few things. The first is it doesn't really matter. The cards were there because at the beginning of the pandemic, there was this idea that the card itself would allow you to get into certain venues. I don't know of any place on earth that still uses that, number one. Number two, the few that do, to the extent that vaccines are still mandated in places, there are other ways of getting it that are almost easier, if you will. Number three, I don't know of any place that requires you to have 5 vaccines. So I guess from that vantage point, you're okay. A few other things. Your record is still available electronically. And I know it can be daunting, but if you can get to your electronic medical record, particularly what I always do, and I would encourage others to do this, is I use my primary care doctor as the recipient of all of my medical records. No matter who I'm going to see, I send everything to my primary care doctor so that I have one place that I can go to get everything I need. And my primary care doctor has made it so easy. On their portal, there's actually a button that says click here for your COVID records, and you can print it out, and it comes with a QR code and everything. So, if you ever needed something, I find that to be just by far the easiest way to prove your vaccination status. So I would encourage you and others similarly situated, regardless of whether you had no room on the COVID card, to try to get the information in electronic form.
Okay, you just led us perfectly in our next bit of news, which is all about health records and digital access. So, a new federal rule under the 21st Century Cures Act says that healthcare organizations must give patients unfettered access to their full health records in digital format.
Yeah, the goal of this is to help patients get their data, and it's up to the patient. It's their data, and they could choose who to share it with and how to share it.
When I first saw this, I kind of thought, don't we have HIPAA? And doesn't that allow for, patients to ask for their records and turn it over? And as I thought about it more, I thought about, when I've tried to get my records, there's a lot of delays. Sometimes they say, we'll send it if you have a fax machine. I don't have one of those. And I'm thinking sometimes they'll offer to send it to another provider. And I'm like, why can't you send it to me? It's all about me.
Yeah, absolutely. Because of HIPAA, actually, it had been a little difficult to send records electronically, and hopefully the 21st Century Cures Act will make it a simpler process to do so. Because clearly, if you're getting hundreds or dozens of pages, it's simpler to get it electronically rather than to try and obtain it, either a hard copy or sometimes, as you said, they'll only do it by fax. I've also had providers in my own personal experience who will do it, but they'll charge you printing fees.
That's not cool. We already pay the co-pays, the co-insurance, deductibles. We don't need to pay paper fees.
I know. I don't even want it in a hard copy. Give it to me electronically. Well, and hopefully patients' ability to get their data means that they can better understand their care, shop for services, and participate in research without waiting for a clinician or a drug company to present them with an opportunity.
Yeah, for chronic disease, you often see a lot of specialists over the years, so it really does matter to have this access. Even like you were just talking about with your primary care, the person that holds all your data, it's really helpful to be able to, move the different things from different specialists over to the right people at the right time.
Yeah. In additional news, many patients, unfortunately, are still unable to afford healthcare costs. There was a recent Commonwealth Fund survey, which was conducted this year between March 28th and July 4th, that found that 43% of working age adults were inadequately insured.
Wow, 43%. But, what does that mean they were inadequately insured?
Well, it means that they were either uninsured, which accounted for 9%, or they had a gap in their coverage over the previous year, which was 11%, or they were insured all year but were quote-unquote underinsured, which the Commonwealth Fund defines as having coverage that still doesn't provide affordable access to healthcare. And that accounted for 23% of cases.
I believe it. It's a lot to pay for your health. And when you have a chronic disease and you're faced, let's say, with this underinsured scenario where you just simply can't afford to pay the monthly bills for prescriptions, or you have an x-ray coming up, you haven't met your deductible, it's a huge copay, things like that, it means that, people are going to avoid getting the care they need, not fill their prescriptions on time, and that can ultimately lead to long-term health consequences and also financial ones as well. It's expensive to be chronically ill.
Yeah, absolutely. Absolutely. Moving on, the CDC is going to stop reporting daily cases of COVID and is instead moving to weekly cases.
So yeah, this comes after 2 years of nearly constant daily updates. This feels like a big change for me.
It definitely is. It's a sign of the times that we're moving on from where we had been, which is a good sign, I suppose. And the CDC said the weekly report are going to allow for more flexibility and will reduce the burden on state and local governments.
It's also similar to how the CDC covers the flu, which is typically on a weekly basis. So, that's more comforting that we're going in line with protocols for other diseases or viruses.
Yeah, absolutely. That's a really good point. Yeah. So let's turn to our topic of today. We're almost at the 3-year mark, if you could believe it, since the first case.
Yeah, my heart is heavy hearing that. It's a big deal.
I know. It's crazy. Well, there's still a lot we don't know. So first and foremost, we still don't know exactly where the virus came from.
True. Yeah, we still don't know that. We had an episode on that maybe a year ago now.
Yeah, we haven't been able to confirm definitively that the virus came from the seafood market in Wuhan, China. There are are peer-reviewed papers on the theory, but we still don't know key details like where in the market it happened or which animals were involved, what drove this. And the Chinese Communist Party is not allowing outside investigators in to try and solve that, in order to better situate ourselves for future diseases.
And the other theory that we haven't, I guess, debunked or ruled out is the possibility that the virus escaped from a lab in China. And, when we think about why it's important to know this, it's important for, disease surveillance, monitoring, and preventing other infectious diseases. We've seen monkeypox and polio in the news recently, and we really do want to have our public health measures in place to prevent outbreaks.
Yeah, I know. To me, it boggles the mind that we can't get in to investigate, to learn what happened so that we can help better prepare ourselves for the future. I mean, this could happen again if we don't learn from it.
The next thing we don't know is how is the virus evolving and will there continue to be new variants?
Right. And, scientists believe that it will continue evolving to become better at escaping the human immune system, but researchers are uncertain about what future variants might look like.
And we know that immunocompromised people play a role in new variants, and this is because, unfortunately, the immunocompromised body is like a good breeding ground for these variants. But we also don't know the extent to which that occurs, which is, there's a few unknowns here. It's like, will the virus keep evolving? Will there be new variants? And how do immunocompromised people play a role in this, which is a bit scary for our community. We want to make sure that, we're staying safe.
Yeah, no, absolutely. Speaking of variants, just one interesting note, over 90%, I think it's at 92%, even higher than that, of cases are still of the Omicron B4 and B5 variety in the United States. So it's been quite a while that we haven't seen a mutation to another variant, which is even more reason, by the way, why folks should follow Zoe's lead and get the bivalent booster, which is specifically targeted for these variants.
Yeah, that kind of leads into the next unknown where it's like, can we develop a vaccine for future variants? We kind of been like a step behind the virus. Now it feels like, based on what you were just saying, it feels like, we're at a good spot with the bivalent vaccine for Omicron because those are the dominant strains still, but it almost feels like we've been chasing it a step behind. So in the future, could we be able to develop a vaccine ahead of time that'll predict a new variant, kind of like how we do for the flu each year?
Yeah, there is a nasal spray vaccine in the pipeline, which experts hope will work in the respiratory tract more, although we're not certain about that. Experts say we should expect to get a COVID shot every year, like the flu shot, which is adapted each year for the best guess on the variant. So we'll see.
Also on that topic, our community is really interested in measuring the level of antibodies and seeing, what amount is a good amount that you're protected. I know antibodies are just one part of the picture. There's also the T cell response. So it's like a little bit hard to get a definitive yes or no. But, as we develop vaccines and look at protection, I know our community wants more research on the level of antibodies needed to stay safe.
It would be incredible almost to have an at-home kit to be able to test yourself, not having to go to a doctor. Just test yourself, and when your antibodies hit a certain level, it's time for another shot. Or conversely, if they're at a certain level, you may not need another vaccine at that moment, which is good to know as well.
Speaking of at-home kits, I'm still loving the at-home test. Like whenever I feel like I have like a little something or I was in a crowded area, I just go to the bathroom, take out from the closet my at-home kit, and I feel so good about it.
Yeah, I know we're getting off topic, but I also wonder what it would take to develop an at-home kit for flu as well, or a 2-in-1.
2-in-1 would be great.
Yeah, just to know. Another one we're still looking into is long COVID. According to the CDC, 1 in 5 folks with COVID go on to develop long COVID.
1 in 5 is a huge amount. First of all, we really don't know how long COVID is. Is it a chronic disease for the rest of your life? Is it symptoms for a few months? It's really different for everyone, it seems like right now. We don't know what's driving it, and we just don't know too much about it. And to think that 1 in 5 are getting symptoms that last longer is a tremendous amount of people that are in pain or, just struggling day to day.
Yeah. And what does it mean for the immunocompromised community?
True, if you already have conditions and underlying conditions and now you have this other thing on top, it's like probably really, really challenging to deal with. And we need to answer some of these questions in order to get effective treatments.
Absolutely. Another question is, why does the severity differ by age and by person? When can high-risk individuals return to a normal life?
It's true. We've seen with COVID, the younger the patient, the less the risk. Just given like a healthy population, kids have been spared from, a lot of the brutal, severe infections. But the weird thing is that people of similar health profiles can have a different severity. I mean, I think we saw this really in the early days of COVID. It was like so random who would end up in the hospital. Now we have vaccines which prevent against severe illness, so it isn't maybe as obvious, but it was just like there was no pattern or rhyme or reason to who got the severe illness, it felt like.
Yeah, no, absolutely. People of similar health profiles have different severity levels. Also, when we talk about returning to normal life, that means something different to different people. And if you're immunocompromised, you of course want to be sure to stay up to date on your vaccines and preventive measures if recommended.
Yeah, it's true. There's no timeline on when COVID's over. We talked about this at length and, we'll continue talking about it because it matters to our community. And knowing your risks and talking to your doctor is just such an important piece of that timeline as we all figure it out together. All right, Steven, that brings us to the close of our show. What did you learn today?
Well, I learned that despite us being 3 years in, there's still so much we don't know about COVID.
And Steven, I learned from you about the new rule that's going to help patients access their electronic health records digitally.
Excellent. Well, we hope that you learned something too. We'd love to hear from you about your advocacy stories. Send your email to thehealthadvocates@ghlf.org, or better yet, include a short video or audio clip.
And who knows, whatever you share may be included in our listener feedback portion of future episodes.
Also email us if you want to subscribe to our weekly newsletter where we share the top health news of the week.
Well, everyone, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you like this episode, give us a rating and write a review on Apple Podcasts and hit that subscribe button wherever you listen. It'll help more people like you find us. I'm Zoe Rothblatt.
I'm Steven Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.